your eyes.
Agora abre os teus olhos.
And if you can see something, shout.
Se consegues ver, grita.
If you are able to see something, lift up your hand.
Se consegues ver algo, levanta a tua mão, se estás a ver.
That is how we will know you.
É assim como vamos te conhecer.
Open your eyes.
Abre os teus olhos.
If you can see something, lift up your hand and shout, I can see now.
Se consegues ver algo, levanta a tua mão e grita, eu consigo ver agora.
Sorry? Can you say it, please, very fast? We don't have time. Say it again. If you can see, let me know. If you see something or light, loose, lift up your hand. Open your eyes. If you can see light, let me know. Look at that now. Thank you so much. Come over. Come to me. Come to me. Okay, you can see me very well. That's very powerful. Somebody clap to Jesus. One person already out. One person is out. One person, thank you, Pedro, Dr. Pedro. One person is out. Come and stand here. One person is out. Can you take this? Take it. That's powerful. His eyes have opened. Now, if you can see anything, even light, lift up your hand if you can see light. This woman is going to see something. My daughter's eyes have opened. My daughter's eyes have opened. She saw me from there.
Mko kabisa kwamba isitoshe Kristo alienda msalabani ili kwamba tusiingie jana, tusiingie katika.
Receive.
Receba.
Oi. Open it.
Abre agora.
Jesus is Lord. Yes.
Sim.
This is very powerful.
Isto é muito poderoso.
And drink it.
Agora beba.
Hold it properly and drink it.
Pega bem e beba.
And open your eyes.
Abre agora os teus olhos.
Open your eyes now and see me.
Abre os teus olhos e vê-me.
Thank you very much. Thank you. Open your eyes and see me.
Abre os teus olhos e vê-me.
And follow me.
E siga-me.
Follow me.
Vem me seguir.
Follow me.
Segue-me, segue-me.
Follow me.
Segue-me.
This is a miracle in the making. This is a brand new miracle.
Milagre está sendo feito agora.
This is a new thing
Esta é uma nova coisa
happening in the church.
acontecendo na igreja.
A new thing is happening in the church.
Uma nova coisa está acontecendo na igreja.
The pastor from Portugal. Another blind eye. The deaf ears have opened there.
Outro cego.
Blind eyes have opened again. Hallelujah. 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 Blind eyes have opened again.
Outro cego abriu aqui.
Another set of blind eyes.
Outro cego.
Another set of blind eyes.
Outro cego abriu os
Another
olhos.
set. If you can see me, follow me.
Se consegue me ver, siga-me, siga-me.
Hallelujah.
Aleluia.
Blind eyes are. Hallelujah. Follow me.
Siga-me, siga-me.
If you can see me,
Se consegues ver,
take this.
toma isso.
If you can see me,
Se consegues me ver, receba isso.
look at the eye.
Olha os olhos.
The eye is following.
Olha os olhos.
Take it.
Receba,
Receive
receba.
it, receive it.
Receba. Ah.
The blind eyes have opened. opened ears.
Os cegos abriram os olhos.
Very powerful. Very powerful. She's following me.
Ela está me seguindo.
If you can see me, follow
Se
me.
você consegue me ver, siga-me.
If you can see me,
Se você consegue me ver, siga-me.
follow me.
Siga-me.
If you can see me, follow
Se
me.
consegue me ver, me segue.
Hallelujah!
Aleluia.
Hallelujah! Two blind people.
Dois cegos. Dois cegos.
Follow me.
Siga-me.
Follow me.
Siga-me. Siga-me.
Follow me.
Siga-me.
Touch me. Touch me.
Toca-me. Toca-me.
Toca-me.
Toca-me.
Toca-me.
Toca-me. Se
Toca-me.
consegue me ver. Toca-me.
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 Toca.
Toca.
Follow me.
Siga agora. Siga agora. Siga.
He's dancing. Hallelujah! With the power of the blood.
O poder do sangue.
The power of the blood.
O poder do sangue.
Touch me if you can see me.
Toca-me.
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 Vem me tocar. Toca-me.
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 Toca.
Toca, toca.
Toca. Revival.
Avivamento.
Revival.
Avivamento.
Every year
Todos os anos.
at this time
A esta hora.
I will be in Maputo.
Eu estarei na puta.
That is established.
Está estabelecido.
established
Está estabelecido.
every year.
Todos os anos.
Every year.
Todos os anos.
At this time,
A esta
it
noite
will be called
será
Maputo Revival.
Maputo Revival.
Every year.
Todos os anos.
Revival. Hallelujah.
Aleluia.
I tell you,
Eu te digo.
this is too big.
Isto é muito grande, filho amado.
I am ready.
Eu estou bravo.
I am ready, Dr. Pedro.
Eu estou bravo.
I want to come.
Eu quero vir.
Look at the blind people following me.
Olha os cegos que estavam me seguir.
And Transworld Radio is looking at
E o
it.
mundo transmundial, a rádio transmundial.
Radio Mundial is seeing
Rádio transmundial está vendo.
the blind people following
Os
me.
cegos estavam a me seguir.
Revival
Avivamento.
is beautiful. The revival is beautiful.
O avivamento é bonito.
Revival has broken out in the land.
Avivamento.
Revival has broken out in the
O
land.
avivamento rebentou na terra.
Look at that.
Olha isso.
Revival has broken out.
O avivamento rebentou.
Revival has broken
O
out.
avivamento rebentou.
Revival has exploded.
O avivamento explodiu.
Hallelujah.
brother and
Salvation. Volta-se a salvação. Is holiness. É santidade que é necessária. Angola. The nations are preparing for the coming of the Lord. Vocês agora, as nações estão se preparando para a vinda do Messias. Angola. Will Angola prepare? Será que Angola vai preparar?
Now Angola has to repent.
Agora Angola tem que se arrepender.
And prepare for the coming of the Messiah.
E preparar a vinda do Messias. Today, hoje, I have come to announce. Eu vim aqui anunciar that there is a revival. Que há reavivamento. A holy revival. Reavivamento santo. Visiting the nations right now. Que está a visitar várias nações agora. Time is over. O tempo terminou. I have seen the Messiah coming for the church. Eu vi o Messias a vir buscar a igreja. And the Bible says, e a Bíblia diz, that the bride of Christ must be holy. Que a noiva de Cristo deve ser santo. The bride of Christ, a noiva de Cristo, must be without stain. Deve ser sem mácula. Without wrinkle. Sem manchas. Let us begin now. Vamos começar agora. There is so much work. Há muito trabalho a ser feito. Prepare the way, Angola. Preparai o caminho, Angola. I have seen the two wedding rings for the wedding of the Lamb of God. O Senhor me mostrou os dois anéis de casamento para as bodas do Cordeiro de Deus. The time for harvesting the souls is now. Que chegou a hora para ir colher aquelas almas agora. And only the church has the answer. E somente a igreja tem a resposta. Only Jesus is the answer. Somente Jesus é a resposta. Whether for economy, seja para a economia, whether for disease, seja para a doença, whether for eternity, seja para a eternidade, whether for marriage, seja para a Jesus is the answer. Jesus é a resposta. Hey! Did you understand? Você compreendeu? He's saying, ele está dizendo, there will not be a second Calvary. Não haverá segundo Calvário. The Lord is sending me here. Enquanto que o Senhor está me enviar aqui, and telling you, para te dizer, please prepare. Por favor, prepara-se. The Messiah is coming. O Messias está vindo.
Father, you who is the God of Abraham,
Pai, você que é o Deus de Abraão,
the God of Isaac,
o Deus de Isaac,
the God of Jacob,
o Deus de Jacó.
Father, I welcome you here tonight.
Pai, eu te recebo aqui hoje à noite.
You can visit here,
Você pode visitar aqui.
visit your friend here,
Visita o teu amigo aqui.
and love these people.
E ama esta gente.
Father, in this place,
Pai, neste lugar,
people have come here
as pessoas vieram aqui
from many places.
de muitos lugares.
Some of them are sick,
Alguns deles estão doentes.
a large number.
Grande número.
Some are crippled.
Alguns estão coxos.
Father, I ask you to help the crippled legs
Pai, eu te peço para ajudar os pés coxos.
and the lame legs
Deixa que os pés paralíticos.
and the paralytics.
Deixa que os paralíticos.
Father, strengthen them
Pai, fortifica-os.
that the cripples and the lame may walk here
Para que os coxos e os paralíticos possam andar aqui.
with power
Com poder.
in the mighty name of Jesus.
No nome poderoso de Jesus.
Amen.
Amém.
Finished.
Acabou.
Everybody, wherever you are now,
Toda pessoa onde você está.
now you can receive your healing.
Agora receba a tua cura.
What has
O
happened?
que aconteceu?
Why are they running with the baby?
Por que estão a correr com a bebê?
My Lord.
Meu Senhor.
Hallelujah.
My Lord. Meu Senhor.
This baby has never walked.
Esse bebê nunca andou, nunca
A
andou.
crippled baby has walked.
Bebê coxo andou. Bebê coxo andou.
A crippled baby.
is Dr. Kennedy Otieno. I am a medical physician, currently a registrar at Moi Teaching and Referral Hospital, which is the second largest health institution in the nation of Kenya. I invite you along to look at a case of acute myeloid leukemia. For starters, leukemia refers to cancer of the blood cells. Blood is a very important component of the human person. Everything that occurs in the human body is achieved either directly or indirectly by the help of blood. For example, when you breathe in, the oxygen that you take in is transported to the end or the terminal tissues by and through the use of your blood. So when you happen to have a disease that grossly affects your blood, then you can now understand the imminent danger and the peril that such a patient is in. So patients with leukemia have what is called aberrant, dysregulated growth and proliferation of the blood cells. In the blood, we have several cell lines. We have the red blood cells, we have the white blood cells, and we have the platelets. Each of these has a specific role that they need to carry out. For example, the red blood cells are responsible for transporting oxygen to the tissues. The white blood cells are responsible for mounting immunity against infection and foreign bodies. And the platelets are cells that are responsible to ensure that there is adequate capability of the blood to clot, so that you do not run into a situation where you bleed to death. So, leukemia, as we have mentioned before, is cancer of the blood cells. What happens with leukemia is that there is mutation, and the mutation occurs at the level of the bone marrow. The bone marrow is where the blood is manufactured from. And when the cells are ready to mature, they are spilled over into circulation. So when you have these mutations occurring inside of your bone marrow, which is responsible for producing your blood, then what happens is your bone marrow produces aberrant kind of blood. Your red blood cells, your white blood cells, and your platelets are produced, first of all, in excess without control, and secondly, whatever that is produced is non-functional. It is not able to achieve the roles and the functions that we have enumerated there before. So what happens is, as a result of these mutations within the bone marrow, there is overcrowding of the bone marrow by cells, the myeloid cells, which are cancerous. Their control, their growth is not under check. It cannot be checked or balanced by the body's usual system. So the growth is out of hand. And secondly, as a result of that, there is overcrowding within the bone marrow to an extent that the bone marrow goes to a level of fatigue and becomes fibrosed, meaning it cannot produce cells anymore. And at the same time, these excess blood lines are released into the blood system, blood circulation. And when they are released there, they are aberrant, they are non-functional, yet they are aggressive. And in so doing, they choke or they suffocate the proper red blood cells and the white blood cells and the platelets, which are functional. And as a result, we start to see reduction in the count of all the blood cells. This patient, for example, will present with anemia. The patient will present with what is called low white blood cell count. And even their platelet levels will start going down. And the repercussion of this, therefore, means that this patient will start to present with fatigue, difficulty in breathing. They will be pale. They will be anemic. They will also have low immunity, such that they are always susceptible to any kind of infection, even trivial infections that are not supposed to put anybody down, are able to put them down very, very seriously. And the third risk factor that they face is because their platelet count is reduced. What happens is they have ease of bleeding. They can bleed under their skin. They can bleed within the mucosa of their mouth. They can bleed within their brain tissue. They bleed within their joint spaces while they are walking. So, very trivial injuries to the blood vessels result into massive bleeding. And they bleed and lose blood within themselves. So such a patient is at a very, very serious position, because we see the importance of blood, and these functions that are supposed to be met by blood cannot be met. Yet that is what composes somebody who is healthy. And as a result of this, these patients, when they come to hospital, laboratory tests are done. A bone marrow aspirate is taken, and a trophine biopsy is taken and studied. Then the diagnosis is made. From the point of diagnosis, for example, there are several interventions that are known to be undertaken by the healthcare team. There is no general consensus concerning the intervention that is taken for patients who have acute myeloid leukemia, because that diagnosis in itself is equivalent to a death sentence. These patients do not tend to survive, and in my experience, they never come out of the admissions of their diagnosis. What I mean in simple terms is, most of the time when they are admitted and diagnosed, then they complicate and go downwards until their demise, until their death. Because they will have one complication after another. During the admission, they can run into stroke, having bled within their brain. They can go into septic shock because of septicemia, which results from infection that they have acquired even in the hospital itself. Or they can even, because of their anemia, they can also die out of that. So these patients, the intervention that is there most of the time is to transfuse them with blood, to replenish that which the body cannot do. But this does not last long. Remember, the blood cells that are within them are very aggressive, such that even when you transfuse them, the ones that you have transfused are eaten up and mopped up within a very short time. It doesn't even take 3 days. It is all cleared from the system. Now, these patients, the interventions that are available are equally risky. The first intervention, for example, is what is called palliative chemotherapy. When we use the term palliative, we refer to a circumstance or a situation wherewith a patient is informed that your situation is so bad such that there is no way that it can be reversed. The eminence of it is that at the end of this situation, sooner or later, you will die out of your circumstance. So we only come in to ensure that in your death you will be comfortable. We will try to manage your pain. We will try to replenish your blood. We will try to give you antibiotics when you have infections. But we will not be able to do anything substantial as far as reversing your situation of acute myeloid leukemia is concerned. That is what is meant by palliative. So such patients are exposed to what is called palliative chemotherapy. This is chemotherapy that is just given to give them some little comfort, or to give them a painless kind of life even as they go down to their demise. And the next intervention that is also known to be practiced is what is called bone marrow transplant. Bone marrow transplant involves having a donor coming in to give you their bone marrow so they can replace your bone marrow, which was depleted as a result of the cancer that you suffered. And when you have this bone marrow that is brought in, remember your mutation is still intact. So what follows is that even you will clear out, as a patient, you will clear out the bone marrow that you have received in a course of time. So there is no permanent remission that is experienced with bone marrow transplant. These patients die. For example, I've mentioned that here I work at Moi Teaching and Referral Hospital. And the mortality rate of patients, 1 year mortality rate of patients who have AML, acute myeloid leukemia, is 100%. It is so bad that as a caregiver or as a doctor, when you encounter in your ward a patient who has been given a diagnosis of acute myeloid leukemia, it distresses you as a caregiver. It depresses you because you know that much as that patient is there and you're toiling and struggling with them, in the long run, you are going to lose that patient. And that is world over. There is no known AML patient that has ever been brought into permanent remission. Whatever is done, be it bone marrow transplant or the chemotherapy that is given, only prolongs their life for some period of months or weeks, but never gives a guarantee of the permanency of their remission. So that is how bad AML is. In our situation in Moi Teaching and Referral Hospital, I have a colleague who has been doing a study and looking at the patients who they have started on chemotherapy, and the longest who has ever survived on chemotherapy and the best care, nursing in a sterile room, receiving the best chemotherapy available, the best modalities, lived for 56 days, 5-6 days, and that was a success story because they never live beyond 1 month. When they do so, it is counted as extreme luck for them. It is celebrated in the medical fraternity. And these patients are so cumbersome and tiring to deal with. For this reason, their nursing does not occur in the usual ward. They need to be nursed in a completely sterile room. A single doctor that has been draped well and a single nurse that has been draped quite well, sanitized, is the only one that is permitted into their room. Their food is sanitized. Their clothing is sanitized. Their walls and their spaces is sanitized, such that for them to be nursed, even their family members cannot be allowed to see them and interact with them one-on-one in their state of sickness. So you can imagine and understand how dire and how gross the situation of a patient who suffers acute myeloid leukemia is. Now, looking at the interventions available, for example, bone marrow transplant. For AML, the number one risk factor that you meet with bone marrow transplant is death. So this patient is surrounded by death from all ends, even with the interventions that the hospital is supposed to provide for them. They never get well. And in our institution here, the longest success story as far as AML is concerned is 56 days. And that is something that has been put into record as spectacular outcome. 56 days does not even compass 2 months. It is such a short time, yet it is what we celebrate with this kind of patients. So, what I'm trying to say is that the mortality rate of these patients after admission, 1 year down the line, they are all, after diagnosis, 1 year down the line, they are always all dead. They are always all dead as a result of acute myeloid leukemia. You can see how dangerous this cancer is. And having said that, I want us to look at the situation that we are currently faced with. One 8-year-old girl called Patience Faith Wanjiku. She went to Kenyatta National Hospital, which is the largest referral health institution in this nation, and the doctors there diagnosed her with acute myeloid leukemia. And even she was started out on palliative care. The family had conferenced with the doctors, and the doctors had disclosed the fate and the prognosis that faced baby Patience Faith Wanjiku. It was clear that whatever the doctors were trying to do, they made it clear to the parents that the outcome is the same, death. But they would not stop and fold their hands back. They kept trying. To an extent that they even suggested that Faith needed to travel outside the country in order that she may have a bone marrow transplant. So what they did with Faith is they introduced her to chemotherapy. And she went through the first cycle. And as I have mentioned that all the interventions that are available to Medicare right now all point towards death. When she was introduced to her first cycle of chemotherapy, she went into septic shock, meaning that she became even weaker as a result of the disease compounded by the chemotherapy. Her immunity went lower, such that she got a bacterial infection such that even her own body could not sustain her blood pressure. Her blood pressure had to be sustained using medication, and she had to be moved into the ICU as a result of that. So we always know that once a patient, that is the trend that we understand, that they come from the ward, they start chemotherapy, they go into the ICU, then they die. But Faith is one story, the only story known and recorded and documented in the highest health institution with the most credible oncologist, pediatric oncologists in the nation, as a patient who walked well and healthy from the ICU, having gone in there with septic shock as a result of, as a complication of having AML. It never occurs. We have seen the pictures and we have seen the videos of Faith patients playing, jumping, marching, celebrating, singing, smiling, and playing outside of the compound. Things that are counted as a taboo for a patient who has been diagnosed with acute myeloid leukemia. Because first of all, a patient with acute myeloid leukemia needs sterility 24 hours of the day, 7 days of the week. Their house must be sterilized every 5 to 10 minutes. The plate that they use, the spoon that they use, the cup that they use, their tabletops, their floors, their walls, they are not even allowed to touch toys or to play, because that in itself may bring in some kind of contamination which will subject them to infection. But Faith is playing outside. Faith is jumping and touching the floor. She is not in a sterilized environment anymore. She is eating alongside his family and with everyone else. She is able to board our public service vehicles alongside every other person, which is unthought of for a patient with acute myeloid leukemia. And on top of that, laboratory tests have now been done to come and show that once she went in at diagnosis with an HB, a hemoglobin level, red blood cell level of 6.7, today her hemoglobin level is 14.4. It is even more than sufficient for her. When she had an erythrocyte sedimentation rate, which was too high, of 36, today, very, very rapidly, which is unusual, her ESR has come back to normal, being 16, the normal being between 0 and 20. When she went in with platelet counts, she was admitted and diagnosed with a platelet count of 61. But now she has a platelet count of 340 something within a very short span. So that translates to this. Because she has not received any transfusion, she has not received any bone marrow. That translates to this, that once there was very, very severe situation happening within the bone marrow, millions and millions of mutations having occurred and manifesting in the way that it did for her initially, there is a hand that is unknown to science and unknown to men that has gone into the level of the bone marrow to delete the mutations and to bring order where there was disorder within the bone marrow, and to release a command of sanity to the bone marrow, such that in a single go, the bone marrow is now able to produce red blood cells and white blood cells and platelets that are normal and are totally functional, as we are able to see with the evidence presented for the case of patient's Faith Wanjiru. Science cannot take any credit for this, because chemotherapy is not known to bring this kind of relief to acute myeloid leukemic patients. Even bone marrow transplant is not known to bear this level of success to the AML patients. Regardless of what you go through, even if you go through the best of the bone marrow transplant, the average hospitalization period is 16 months. Meaning that you will have to remain in a sterile situation as you wait to go into some temporary remission for 16 months. When you are receiving immunomodulators, you are receiving medication vigorously, very, very expensive medication, for 16 months before you can ever step out. But within no time, Patience Wanjiru has walked straight from the ICU to the playground. She has walked from death to life. She has come from the mouth of the grave, because AML is equated to death. She has literally been pulled out from death, from complete hopelessness, into a situation of new vibrancy, new life, new state of energy, and a totally healthy young child. I can only say that science cannot take credit for this. A bone marrow that was subdued by mutations and cancer cells was able to come back to life and order again. It is only the work of God. Now we have a place to go to. Now we have a place to refer our AML patients when it is so dire and distressing for us.
I'm Aaron Langat from Tenwick Mission Hospital, based in Bomet County. I have a specialty in oncology, cancer care. I'm also a trainer of trainers in chemotherapy. And we are looking at this case of acute myeloid leukemia, or AML. It is a condition in which the white blood cells, leukemic blast, the white blood cells undergo transformation. This is a malignant process where the white blood cells undergoes transformation right from the stem cell. Know that, realize that myeloid is the precursor of 3 cell lines, that is the red blood cells, the white blood cells, and the platelets. So for this case, the white blood cells itself undergoes some transformation. It's a malignant process that happens through some mutation brought about by changes in the genetic makeup. And therefore, the bone marrow itself, or the stem cell itself, is now able to produce immature white blood cells in large amount. And when it is tested, it is more than 20% for it now to be identified and to show some clinical signs and symptoms. So therefore, when the white blood cells undergoes this same transformation, and it is multiplied rapidly, more than the other cell lines, it suppresses the production of the red blood cells. And we know in the red blood cells, the patient will be anemic because of low HB. The oxygen carrying capacity will be hampered with. At the same time, because of the platelets that has been suppressed also, the patient will bleed profusely. And then the capacity of the body to fight infection is hampered with, because the production of this white immature blast, the leukemic blast, are not able to function normally to fight infection in the body. So the patient will come to the hospital because of recurrent infections. And when they come to the hospital, they present with a flu-like symptoms. And when they come to the hospital, we run some investigations. First of all, we do the complete blood count, or full hemogram. We also do the liver function test, the kidney function test. We want to ascertain the general condition of the patient. Then when we look at those cell lines, the red blood cells, this derangement in the values, and in this case we will find out that the leukemic blasts are more than 20%. The red blood cells is low. The platelets are also minimal, less than 150, and therefore the patient comes to the hospital with bleeding. Be it bleeding under the skin, petechiae, bleeding even inside the organs, the spleen, the other internal organs. At the same time, this patient will present with fatigue, because now there's that inability to be able to have sufficient oxygen. There's low hemoglobin. At the same time, this bleeding will accumulate inside even the heart, on the pleura. And therefore, the patient will also have low blood pressure. The patient will present to the hospital with recurrent infections. And therefore, this patient is taken, done physical exam, done investigation, and then finally we also take a sample, a biopsy, and in this case we go straight to the bone marrow. We do some aspiration on the bone marrow, where the bone marrow is drilled and enter the marrow and aspirate the content of the marrow for analysis. So when the content has been taken, the sample is taken to labs like the Lancet or the Akagan. They run some tests. The pathologist will examine and give us the result. And finally, what we expect in acute myeloid leukemia, the level of leukemic blast will be obviously above 20%. And the level of the red blood cells and the platelets will be minimal, will be low. And therefore, this patient now begin initiation of therapy. And in this case, the available options for treatment. And remember, in acute myeloid leukemia, the goal of therapy is just remission. We are trying to clear the leukemic blast. Remember, acute myeloid leukemia is not like any other disease. just like an headache or any other disease that will somehow clear or that will have full remission. Now, in this case, when I talk of remission, we are looking at the leukemic blasts or these clones, the white blood cells that are produced, which are not normal in shape. And therefore, what happens in this case is that we try to clear those malformed white blood cells through targeted therapy, through chemotherapy. Chemotherapy is a systemic kind of treatment where we use cytotoxic drugs. These drugs are administered intravenously, sometimes also given in oral forms, it can be swallowed. And therefore, the problem with chemotherapy is that it affects every other rapidly dividing organ in the body. That is why the patient will present back to the clinic with loss of hair, alopecia. The patient will have also some changes on the mucosa. Some of them present with mucositis. Some of them present with nausea and vomiting. And at the same time, following initiation of chemotherapy, the same patient will present with other symptoms simply because when therapy has been initiated and the adverse effect of chemotherapy, the patient needs to be monitored. And for this case of acute myeloid leukemia, the patient is first of all put on induction phase, where he's given high doses of chemotherapy to try and suppress, clear the leukemic blast within 7 days and 3 days of an antibiotic. And then after that, the patient is then put on continuation on consolidation phase, now to be able to pursue the other leukemic blasts that were not wiped in the first phase. But with the same, remember, we are not able to wipe out completely the leukemic blast that produces or that give rise to these symptoms, because the main problem is the production in the stem cell from the bone marrow, and therefore we are able to clear this. We are just on the surface of it, but we are not able to attain cure because we are targeting the already produced leukemic blast, but the bone marrow itself still has mutation, and therefore sometimes this same patient, they also develop other adverse effects like tumor lysis syndrome, because when these leukemic blasts are hit at once, and the body is not able to clear the toxins at once from the kidneys, from the blood system, and therefore the patient will experience an oncologic emergency known as tumor lysis syndrome, and this patient will be rushed to the ICU for monitoring because this is an oncologic emergency. And therefore, even with the same therapy, the patient is supposed to be on continuous therapy for a number of time with rest period where we check blood because of the toxic effect of chemotherapy. The other therapy is targeted therapy. And in this case, investigations are done, advanced investigation like PCR test or polymerase chain reaction test, where the specific DNA is analyzed, the chromosomes are analyzed to note any defect in a particular chromosome, and then the targeted therapy now targets the specific chromosome. Realize that the etiology of AML, it can come from trisomy 21. These are gene defects that happens even during childbirth, and therefore with the same, it is advanced, but the challenge is to be able to locate the same. The other investigation done is FISH, or fluorescent in situ hybridization, where a specific chromosome is also located and then targeted with a targeted therapy to try and eliminate the same. And that now happens in advanced setting, in advanced cancer care centers. And in this case, again, we don't clear everything, even with the targeted therapy. Now, the other available option of treatment is radiotherapy. And at the same time, we focus on the bone marrow to try and direct the high beams, this radiation, this ionizing radiation on the same mutated cells to try somehow to achieve some remission. At the same time, The other option is now to target the bone marrow itself or the stem cell where these leukemic blasts are produced. And therefore, for this case, we need a setup which can provide infusion of stem cell. You identify a donor, and in this case, an allergenic donor. This is somebody, a close relative with the same matching stem cell. Or we can also go for identical twins, where we use the other twin, synergic transplantation. But with the same transplantation, realize that the process in itself is not that comfortable, because the patient needs to be on chemotherapy to suppress the leukemic blast, and then infused with the stem cells, and then even during the same infusion, their immune system is suppressed to be able to allow this patient, the immune system, to be able to produce or to be able to accept the stem cell from the donor. And with the same, we have challenges. So when we are trying the stem cell transplantation, we want to achieve the graft versus the tumor effect, where the stem cell itself from the donor is able to fight back the leukemic blast in the recipient. But another challenge ensues where we have the graft versus the host disease. In this case, the grafted, the infused stem cell is now fighting the immune system of the recipient. And in this case, it now brings up another challenge on top of another challenge. And therefore, we are not able to clear this leukemic blast. Remember, even after the stem cell transplant, there are failure rates. And therefore, the same clients are always constantly on monitoring, back to chemotherapy, back to other medical management like transfusion. We give fresh frozen platelets to try and correct thrombocytopenias and also anemias. The patient is put on antibiotics because they present frequently in the hospital with infections every now and then. At the same time, we need to monitor the liver function test, the kidney function test, and all the other tests in the body to be able to help this patient. But this is an ongoing process. At the same time, it has failure rates. Even with the clinical trials that have been done, rarely do we find somebody who has come out of AML therapy treatment that accompanies or that target this AML successfully. And therefore, for this case of this 80-year-old girl who was in ICU, was bleeding profusely, had neutropenic sepsis, at the same time had low blood pressure. Then all of a sudden we realize, we get a report that the intervention that she only received was a message, a reply to a prayer request, which said it is well. Now that is a shocker, because in the arena of medicine and cancer care, interventions that are made are not very successful in terms of treating acute myeloid leukemia. And therefore, when we saw the result of this girl who was confined to bed in pain, remember the leukemic blast, they congest the bone marrow, and therefore in the periosteum they congest it, and there is a lot of pain even in the patient. So the patient is not able to jump to do activities of daily living. But for this girl, she's now jumping, playing normally. And then when you see the results from Lancet, the HB now is 14 from 7.8. That is something miraculous. The platelets are at 312. It was very low. But now, you see also even the shape of the white blood cells. Morphology is normal. Everything is normal. It does not happen. Even with stem cell transplant, it still fail in the long run. But for this, it must be the hand of the Lord itself.
My name is Dr. Charles Lagat. I have worked at Tenwek Mission Hospital. That's a level 6 facility. I've also worked at Aga Khan Hospital, Kisumu, the main hospital in Kisumu. Currently, I work for the government of Kenya under the Ministry of Health. Looking at this condition acute myeloid leukemia is the malignancy of the blood, the cancer of the blood. It's a unique type because it's not like other type of cancers, because management for cancers, normally it can be through surgery where the affected parties are amputated at an early stage. Thereafter, they can do chemotherapy, radiotherapy. But for the cancer of the blood, the general management of acute myeloid leukemia is generally to say supportive. This condition is one serious condition because there is no definite treatment you would give for myeloid leukemia so that somebody can get healed. For the case of Faith Wanjiku, she was in the most acute situation and she was transferred to the ICU at Kenyatta. The hemoglobin level was at 7.8 grams per deciliter. She was already in hypovolemic shock. She was put on vasopressins. Wanjiku was also on strong antibiotics because of uncontrolled repeated infections of the blood, sepsis. So normally the pathway that is known for this situation, especially for the stage that Faith Mugo was in already, we've always known that it's going to compromise the body organs, the kidney perfusion will reduce, and then you realize that the patient is going now to deteriorate, and then the multi-organ failure, and then the person normally dies. If you went inside Kenyatta National Hospital Intensive Care Unit, where Faith Wanjiku Mugo was, already people were giving up, and they resolved to hand over this child to the palliative department. Palliative department was just to kind of help the family, provide counseling, and that is all. I have not had in my entire career, 8 years of service in this field, I have not heard of any patient who has been in this condition and then got some kind of treatment and then was healed. For her condition, I am told she received a message from the servant of God that it's well, and then her condition improved drastically and she was out of the ICU. What has just come to my desk today, this is a miracle of its own. It's a wonder. It has never been expected in the medical field for such changes. The hemoglobin level, at some point when she was sick, she was 7.8 grams per deciliter. Right now, the hemoglobin level is 14.4 grams per deciliter. And we are talking about somebody with acute myeloid leukemia. The platelet level was initially 61, meaning this person can bleed actually to death. But right now, the platelet level is at 312. They also did the erythrocyte sedimentation rate. Normally, the normal parameters is between 0 and 20. It was elevated initially all the way to 37. Right now, as we speak, the latest they did was at 16. So what am I supposed to say in a situation where in the medical field there is obvious impossibility, obvious irreversibility? So it's a miracle, it's a wonder, this is big, it's actually a miracle of all miracles.
My name is Dr. Toromo Goche. I am a director at the Department of Health, Nakuru County, Kenya. Acute myeloid leukemia is one of the worst cancers we have ever seen in medicine. It is actually of a known cause. In many cases, you cannot know the exact cause, but it is actually the problem is at the genetic level, where there is a mutation of the DNA material of the stem cells. The stem cells are the precursor cells of the bone marrow cells. So when this abnormal transformation occurs, there is production of so many what I can call useless cells in the bone marrow, which occupy the space. So the bone marrow is producing abnormal cells at the expense of producing the normal platelets, the normal red blood cells, or the normal white blood cells. So in most cases, the signs and symptoms of the disease are usually due to the low levels of the red blood cells. So you find that these people who have got acute myelocytic leukemia, acute myeloid leukemia, often present with shortness of breath because they have low hemoglobin level, and that is why the blood is not able to carry adequate oxygen. They have also reduced white blood cells, the normal white blood cells, because they are producing a lot of abnormal white blood cells. So they suffer severe infections. And most of these people normally get severe infections which are actually life-threatening. They also have a reduced number of platelets in the blood. And you find that most of these people suffer easy bruising. They also suffer from hemorrhages. So this condition is a very bad disease with a poor prognosis. And it is usually of an acute abrupt onset. And it usually leads to death. And personally, I have come across many of my patients who have succumbed to the disease. So it is a very challenging disease. Even its management is not easy because the chemotherapy which you normally use, where you have to give somebody several courses of very toxic chemotherapy, sometimes they become toxic and they may also affect the bone marrow, the one you are trying to rescue. You can also maybe attempt radiotherapy. Eventually, in most cases, they normally go for bone marrow transplant. And there are also challenges. It's not a very easy process because you have to look for a donor where you have a match so that there is no tissue rejection. You have to get a donor where there is compatibility of the tissues. And to get such a donor is not easy. So one of the challenges also of this disease is that even upon treatment, you get some kind of remission, and then in most cases they relapse. So we are dealing with a very severe condition. So when I looked at this child who actually was healed of this acute myeloid leukemia, it was very shocking because there has never been anything like that which has been documented in medicine. This is something which you have to put up for life. In fact, most of the interventions like blood transfusions to replace the kind of blood cells which are actually lacking, maybe the platelets or the red blood cells, are actually supportive. It's not a kind of supportive management, but you have to bear with the condition for life. And in most cases, many people have died. I remember even me, I have lost a colleague when we were in first year. He died and he succumbed because of acute myeloid leukemia. So when I looked at the picture, the test after healing, where you find that now the bone marrow has regenerated and it is now producing normal cells in morphology and in number, adequate numbers of platelets, right sizes of the cells, morphology is okay. Then it was very shocking to me because I have never seen anything like this in medicine. Because it is like now the divine intervention which this child got from God is that it has actually, it is like a new bone marrow was inserted. Actually, a bone marrow transplant was done for this baby because now there was no way she could have produced normal white blood cells after suffering from this acute myeloid leukemia. It is very impossible. So these are some of the things which medicine has not been able to achieve despite its advancement. So when we see such things happening, we are shocked and we really want to know how this power operates. This power that is able to change such a malignant transformation of the bone marrow. It's actually a cancerous bone marrow, which when it tries to produce normal cells, it produces abnormal cells. So this is something which is very shocking in medicine, and I think it is this kind of divine intervention, this kind of healing that we have seen has actually shocked the medical fraternity. And I'm here as a medical practitioner, which I have practiced medicine for the last 24 years. I'm saying I am in shock because of this thing that has happened, because it has never happened before. I have managed quite a number of people with the same condition, but in most cases they die. They don't live long. The prognosis is always very poor. So I fear this power that has done this miracle.
My name is Dr. Vera Elazia. I am a senior registrar at the Aga Khan University Hospital, Nairobi. I have a clinical work experience of 13 years. So the case of acute myeloid leukemia, it is a cancer of the blood, the cells of the blood. So it is a very devastating condition. Nobody likes to hear the diagnosis of cancer ever in life. But now to make it worse, acute myeloid leukemia is now the cancer from the blood cells, the bone marrow. And we know that the bone marrow, the blood cells are very important for sustaining life. So what happens in this type of leukemia is that the cancer affects the myeloid line of blood cells. This is just a subgroup of cells that are responsible for producing the red blood cells, the white blood cells, and the platelets. So it is characterized by rapid and controlled proliferation, that is rapid multiplication of the cells of the bone marrow. So what happens out of the normal? Like, why is it that this happens and in healthy people it doesn't happen? So in these cases, you'll find that the patient might be predisposed to some genetic syndromes or some form of genetic syndrome, or it can just occur sporadically, whereby you'll find that there is gene mutation in the chromosomes that perform the functioning of the red blood cells and the white blood cells and the platelets. So when there is that variation, when there is that gene mutation, genetic mutation in those cells, you'll find that instead of the bone marrow producing the normal cells, the normal red blood cells, the normal white blood cells and the platelets, you'll find that because of that chromosomal mutation, there's that genetic variation. So in these people, instead of the cell growing, we have the primitive cells in the bone marrow that we call them the progenitor cells. So these cells are very important in maturing from the primitive cells to a more mature cells which can function. It can fight diseases, it can carry oxygen in the blood, and it can help in clotting of the blood. So in people with leukemia, that is cancer, this cancer of the blood, you'll find that process is arrested. So at some point, instead of the cell transitioning very well to a mature cells which can function very well, there's that arrest of the growth process. There is that arrest. So at this point, you'll find that the bone marrow will produce very many cells, but the cells are not mature, they are abnormal, and they are not functional. So the bone marrow will thrive to compensate for this, producing very many cells. But because of that mutation, this is impossible. So when you look through the blood of these patients, you'll find that they'll have very many, the cells are there, but there are very many and they are very abnormal and they don't function. So with the time you'll find that these cells will crowd in the bone marrow, they'll crowd the bone marrow. And the bone marrow, this will lead to bone marrow failure. So this bone marrow failure, the bone marrow will now be overwhelmed. So the cells will start spilling into the blood system, the circulation system. At this point, when you do a peripheral blood count, you do a full hemogram, such tests, you'll find that abnormality in those cell lines. So at this point, when there is that spillage and there is that impairment of the production of these cells, the patient will present with some signs and symptoms. So these patients, because of that suppression, the normal cells are not formed, but the abnormal cells are being formed. You'll find that the functioning of these cells is impaired. So you'll find that this patient, because the white blood cells production is impaired, these patients will not fight diseases as a normal human being. You know, the blood cells are very important in fighting in the immune function. So you'll find that they are very susceptible to infections. They'll get a lot of infection, recurrent infection, from one infection to another, from one infection to another. Even the very rare opportunistic infections that we don't expect people to get, that the fungal infections, these patients will have those kind of infection, opportunistic infection. So it's usually very devastating. And they now start manifesting with bleeding. They bleed from the gums, bleed from the abdominal system. So they can even bleed from in the eyes. You'll find that the eyes will become red, what we call subconjunctival hemorrhage. They'll bleed even in the urine because the platelets are not functioning. They are not there. The normal platelets, they are not there. These patients have abnormal platelets. So at this point, you'll find that now the parents, like in the situation of patients fail, at this point when the patients start manifesting these symptoms, is when the parents realize that there is something wrong. Because these patients will start bleeding from the gums everywhere. It's usually abnormal. They'll become very fatigued, very tired, very weak. And with this continuous bleeding, you'll find that the platelets, the more the patients bleed, the more the platelets are being consumed. So at times you'll find that it becomes an emergency and these patients land in the ICU. Because of things, complications, now the complications can start setting in, like the disseminated intravascular coagulation. Because the platelets are being used, the body cannot have enough to form the blood clots. So you'll find that they'll have very many complications. Neutropenic sepsis, bleeding, DIC, thrombocytopenia. So the things are just many, hypertension. So at this point is when we normally take these patients to the ICU, where they need a lot of support and a lot of close monitoring. So, because acute myeloid leukemia in general is a cancer caused by genetic mutation, that is, there is DNA mutation in the cells. There is no cure for leukemia. So the first line that we normally do to these patients, the first line of treatment, is to give them chemotherapy. So these are very strong medication, very strong, and they have very bad side effects. So what happens with chemotherapy is that it is a form of therapy that tries to induce remission. Remission is when when the patient doesn't have signs and symptoms of leukemia. So we start with the induction phase and then the consolidation phase. It's usually a journey, a very long journey for these patients. So some patients may go into remission, some they fail to go into this remission. But remission, which I've already said, is the disappearance of the symptoms. It doesn't mean that the patient is cured. In acute myeloid leukemia, most of these patients will have relapse. So after some time, after giving them the chemotherapy, they might have a 1-year period of disease, like symptom-free. They might be able to do some things that they were not able to do. But now, after a certain period of time, they go back into relapse. So when relapse occurs, they now go back like the disease has come back now fully fledged in its original form. It's usually a very dire situation because once the first chemotherapy, like the induction and the consolidation phase, once a patient gets a relapse, the chances of the prognosis becomes poorer and poorer. So, in well-developed countries, like in India, you'll find that they'll do some technologies, what we call the allogenic stem cell transplantation, whereby it's a form of bone marrow transplant. So what happens is that those patients who are able to get the remission, they undergo this transplant to transplant like bone marrow from another person to now get it into this other person. Remember, leukemia is a genetic mutation. It's a chromosomal genetic mutation. So unless gene therapy is done to correct the genetic mutation, the cure you cannot attain cure. You can only go into those remission states, remission whereby at this point you are usually just hopeful, praying that the patient doesn't go into relapse. So these patients normally will need a gene therapy to correct the defect. Now to correct the chromosomal defect, to bring it back to normal. And this has not been achieved so far. In Kenya, so far, to the best of my knowledge, I don't know of any center that is doing the stem cell transplantation. Most of the patients we refer to India or outside the country, like in the UK or the USA. So it is still something that a lot of research is still being done on acute myeloid leukemia. In the last 8 years, there's so much, because it's a very devastating condition. So there is so much research that is still going on to try to find the cure, the gene, but so far there is no therapy for that. So these patients normally, we enroll them very early to palliative care. So palliative care is just to start the journey. Like you know very well, the life expectancy of this person is not the same as that of the normal population. So we take them through, we introduce them very early to palliative care, just to help with the pain control, blood transfusion. Palliative care is just supportive for the signs and symptoms of leukemia. It doesn't even bring any cure, just to make the patient comfortable and to help the patient to live a better life. So this case of patient's faith is very outstanding to me. One thing I know is that when patient's faith was very sick, she was admitted in the ICU, she was transferred from one hospital to another, and then she landed in the ICU. It's usually very tough for the family. So the family, in fact, what we do, like giving patients the diagnosis of leukemia, we just don't give them, from the way I've been trained, like you really have to organize, you really have to get the mother, the family members, organize a family conference, tell the mother to come with somebody that she trusts, somebody to come with somebody, because the diagnosis is usually very difficult to break to these patients. It's not easy to just go and tell the patient, your child has leukemia, so we'll do this and so. So it usually needs a lot of preparation, a lot of emotional, psychological aspect of it. You need to counsel the patient. You need to talk to them. You need to prepare very well how to break the bad news, because it is a journey that is not easy. I've seen so many patients, I've seen so many children undergo this journey. They go through a lot of bone pain in the bones, because the bone marrow doesn't function very well, it's overloaded, so they go through a lot of pain, and the children cry so much, and they bleed from everywhere. And they get very strange infections, like the fungal infections, which are not very normal to the normal population. They get very strange infections. So these patients are usually isolated. You treat them in a very secured place, very isolated, where you don't want the rest of the population, the rest of the people to go there, with very high standards of hygiene, because any little trigger, any little infection can knock them off. So for patient Faith, who is an 8-year-old baby, for her to go through this, they were now hopeless, because the doctors had explained to them the prognosis and everything, and they were very hopeless. To me, as a doctor, having seen so many patients with acute myeloid leukemia, so many families go through a lot of suffering. So many little kids, they don't understand the situation, they don't understand what is going on with them. They are usually very hopeless in the hospital beds. So for me to hear of this, that patient's faith is now back to normal. She is even doing house chores. She can walk. She can do what she was not able to do within a short span of time. It's very historical, and it's very outstanding. This is very impressive, and it is out of the ordinary. Why? Because unless the chromosomal abnormality that patient had, that chromosomal genetic mutation that she had was corrected, there is no way that patient can rise from her disease, her sick ICU ward critical condition, to what she is today. Ability to come back to normal within a short span of time, just after the decree was made that she will be well by the prophets of the Lord. This is very historic to me as a doctor. I'm very shocked. When I heard this news, it really struck my heart. Like, how? How is it possible? I went back to my books. I went back to my journals. I've been searching so hard, like, is it possible for a chromosomal gene mutation to come back to reverse and come back to normal? I've searched, and up to now, there is no knowledge, there is no research that has said it's possible to correct the mutation that occurs in leukemia. There is no correction therapy for that. So for this to occur, this is really outstanding. Honestly, as a doctor, I'm really shocked. It is really striking. And because of this, if the medical fraternity can learn of this, just hearing this, I cannot tie like 1, 2, 3 in the medical field. You can't really tie. There's something that is not, we can't understand. There's something over there that we cannot explain. So this has shocked us in the medical fraternity, and this one, it will not end here because it will be a story that will go on and on. It is a long story to tell. This is very shocking.
My name is Margaret Mwihaki Mugo. I'm married and a mother of 3 children. I have 2 girls and 1 boy. The last born is Patience Wanjiku. Patience started getting sick around mid-February this year. She started getting fevers that would not go down. So the fever would go down after taking medicine. That is, after taking her to hospital and we are given medicine. The fever would go down, but immediately the medicine is over, the fever would come back. So it's like every week we take her to hospital. February and March and the beginning of April. So when on that of April, when we took her to hospital, Premier Hospital, it's in Kikuyu, the doctor noted there was a worrying trend in the blood components. So he noted that the blood components were reducing. And when someone has an infection, the white blood cells are supposed to be many. So the doctor said the white blood cells were so few, and in fact they had reduced within like 2 months. So he referred us to Nairobi Hospital. But when we came home, we decided we would not go to Nairobi Hospital. We decided we would go to Kenyatta National Hospital. So the following day, very early in the morning, we went to Kenyatta National Hospital. And it was taken as an emergency, and therefore Patience was admitted. We were admitted with her because she's a minor, she cannot be alone. So it was on Sunday. So the doctor carried out some tests on her, and one of the tests was the bone marrow test. And on Wednesday, the news were broken to us. She's suffering from leukemia. So it was very devastating. In fact, we were called for a conference. And at the beginning, I was reluctant. But my husband insisted I have to be there. So in the conference room, there were doctors and some nurses and also counselors. Meaning the news were not that good. Yeah, so they broke the news to us. And they said she's suffering from leukemia. They informed us that there are 2 types of leukemia. There is the ALL and the AML, depending on the type of the white blood cells that are affected. But at the moment, they said they hadn't established which type of leukemia it was. So the news was so very much devastating. In fact, we cried, both of us, from 11 to 3. And the counselors were all around us trying to comfort us, but anyway, it was so bad. So it was so bad, it was so bad, by the way. Especially on my side, I've never experienced such a thing. It was so bad. In fact, I would not like anyone to go through what I went through. It was very, very bad. So the same day, my husband was given another sample to take to KYRKAN so that they would be able to establish what type of leukemia it was. So on Saturday, again, we were called for another meeting with my husband, and it was bad again. In fact, they informed us that the type of leukemia she is suffering from is the AML, and they told us it is a very aggressive type of leukemia, and it's also a rare type. It affects about 15% of the patients. And they said, of course, the other type can be managed, but this type, they said it cannot be managed. She has to undergo bone marrow transplant. That is within 3 months because the condition is very much aggressive. Yeah, so, okay. When now the doctor said that she should now be treated using chemotherapy. She said she would start the following week. So on Monday, we agreed. The doctor started the chemotherapy. Okay, she was given from Monday. Then on Tuesday they skipped it. So they would give her and then skip one day for that first week. And then the following week they did give her any. So she was supposed to be given the first week, and then they skip the second one, and then they continue in the third week. You know, she was crying so much because of the injections. So the doctor suggested that they can put a chemo pot. So on that particular Saturday, she went to the theater, and it was implanted around this place. But the doctor had told us that she might bleed because by then the platelet count was so down. Yeah, so when she came from the theater, she was actually bleeding from the neck. And that Monday, they started the chemotherapy again. So I don't know what happened because she started getting weak. So when the nurses came around, they realized that the blood pressure was going down. So they came, they tried to bring it up, and I think they were successful somehow. So at night, that's when they realized she was somehow very much drowsy. She would sleep so much, and even when you call her, she would not answer immediately. She convulsed. So that's when I called the nurses. And they came and checking on the blood pressure again, they found that the blood pressure was so down. So they had to take her to ICU. Yeah. Okay, I called my husband. It was by then it was about 2 at night. So I told him to come, and I hadn't intended to call my sister at Nyahururu, but I dialed wrongly, but I didn't call her. So when she woke up at 3, she found a missed call. So she
Hörer aus Deutschland, ich möchte euch heute bekannt geben, dass der mächtigste Prophet des Herrn jetzt auf den Altar des Herrn zieht und dass ich jede Minute von jetzt für euch live sprechen werde. Seid jetzt bereit, das Wort Gottes zu empfangen. Danke. Blessed people, this is Deputy Archbishop Michael Nieswand, and I welcome all of you to our powerful global revival Sunday service. The two mega mightiest prophets of the Lord are now at the altar of the Lord, at the pulpit. They will come live to you any minute from now. And remember the tremendous and very shocking message they gave us on Friday. we have now understood that these two mega prophets, their work is in the dispensation that is about to come. When you can see the earthquakes, how they have struck the earth with coronavirus, how they have struck the earth with many plagues like locusts, shocking, and many earthquakes shaking the whole earth, shaking nations, and opening heaven. This is clearly now the Lord has identified them to us, that they are for the other dispensations, that they are for the dispensation that comes after the rapture. But what a privilege that they are now preparing the Church of Christ for entry. And we see them, many cripples that are walking. Even today we have a new cripple walking from Utawala. Global celebrations are ongoing. It is very mighty, very powerful, very power-packed. So please, I welcome all of you now to our powerful Sunday service. Any minute from now, the mightiest prophets of the Lord will be live on air. And they will again speak about the rapture of the church and prepare us for the kingdom of God, for entry into the kingdom of God. That is very critical. Nobody can miss. This is very, very important right now. Stay tuned. Be on standby. Thank you. It was very, very mighty, blessed people. Remember, it was very mighty on Friday. The Lord has now revealed His mightiest messengers globally. We have seen the stripes. We now know that they belong to the other dispensation that is coming after the rapture. Let us now prepare very well and be on standby to receive the mighty message from the Lord tonight. Thank you.